Hi, I'm Dr. Stephanie Graff. I am an associate professor of medicine at Brown University and the director of breast oncology at the Brown University Health in Providence, Rhode Island. And today we're going to be reviewing the Adjuvant WIDER study. So Adjuvant WIDER is a phase 3b trial of ribociclib plus endocrine therapy as adjuvant treatment in a close to clinical practice patient population with hormone receptor positive HER2 negative early breast cancer. So we can kind of think of this as an extension of the NATALEE trial. So you all know at this point that the phase 3 NATALEE trial met its primary endpoint of being a significant invasive disease-free survival benefit with ribociclib plus a non-steroidal aromatase inhibitor versus an aromatase inhibitor alone in a broad patient population, ultimately meeting a hazard ratio of 0.715 for patients with the addition of ribociclib in the adjuvant setting. Yet in the United States, we continue to see that breast cancer accounts for 31% of new breast cancer patients, and over 4 million survivors exist. So this is a huge area of need. Black, Hispanic, American Indian, Alaskan Native patients continue to be underrepresented in clinical trial participation. And so the Adjuvant WIDER trial is looking to evaluate the efficacy and safety of ribociclib plus endocrine therapy with some just added focus. There is wider eligibility criteria, which includes extending enrollment to minority patients with some protection to help ensure that we get that patient population, partnership with nonprofit groups, patient advocacy groups, and we're also extending the length of time that patients have been on prior adjuvant endocrine therapy, and also just really focusing on that N0 patient population. And I think all of those things will really drive impact and potential outcomes. So for methods, this is a phase 3b open label single arm trial. So no randomization, everyone gets ribociclib. So it's a great opportunity for patients to get the ribociclib that honestly they were eligible for anyway. They're going to get the drug as a part of the study. Patients are eligible if they're pre and peri and postmenopausal or men. If they are premenopausal or men, they will be taking ovarian function suppression based on the aromatase inhibitor partner. And they will take the ribociclib for 3 years, 3 weeks on, 1 week off at the 400 milligram per day dose in combination with an aromatase inhibitor. The aromatase inhibitor will include exemestane, which is also different than on the original NATALEE study. And then again, if they are premenopausal, they will be required to take ovarian function suppression. Eligibility is otherwise the same in that patients that have N0 disease are eligible if they have grade 2 with an additional risk factor, including Ki-67 of over 20%, a high genomic risk like oncotype score of over 26, or another high-risk genomic profile, or a grade 3 tumor, or if they're N1, and then any anatomic stage 3, stage 2B, so any N2 or N3 disease is going to be eligible. Any prior treatment with a CDK4/6 inhibitor would be an exclusion criteria. And then we are capping at 30% for prior endocrine therapy between 12 and 36 months. So if somebody took something for just a short amount of time and was ineligible, intolerant of it, they may still be eligible for this trial. We are not doing any sort of caps for Black or African American patients, so that will be another factor that drives enrollment for the Black and African American patient population. Primary endpoint will be invasive breast cancer-free survival at 3 years, with sort of what I consider the usual secondary endpoints on adjuvant trials. This looks at the eligibility criteria, which again, we've sort of walked through some of the big ones, very similar to the NATALEE patient population. Patients are eligible if they've been on prior endocrine therapy between 12 and 36 months. And so we're extending that length of time that patients have previously been on endocrine therapy. ECOG performance status up to an ECOG performance status of 2. Exclusion is any prior CDK4/6 inhibitor, pregnancy, or stage 4 disease. Primary endpoints, again, we've talked about really looking at that invasive breast cancer-free survival at 3 years using STEEP criteria with exploratory secondary endpoints. Another, great element of the Adjuvant WIDER trial is that there are embedded biomarkers. There's regular biomarker assessment, which will collect information like blood biomarkers with things like ctDNA and biomarkers from the tumor sample. This biomarker cohort will be in the full patient population and will help us contextualize data that we've seen like at this ASCO on things like Serena-6 even. We need to understand ctDNA dynamics on patients receiving CDK4/6 inhibitors in the adjuvant setting so that we can continue to advance the field and understand what's happening to a patient's ctDNA over the course of treatment. Is it going down? Is it recurring? What do those time points look like? And I think that's going to be a really interesting element of information that's coming out of the study. Dose schedules and modifications are really per package label. If patients start on 400 milligrams, they have standard dose reductions down to the 200 milligram dose. And if patients have an interruption that lasts longer than 28 days due to unresolved ribociclib toxicity, treatment resumption after dose adjustment may be considered. On the original Natalie study, patients that had a long drug hold for something like LFT abnormalities that sometimes take longer than 28 days to resolve, they came off study. So we saw a lot of the drug discontinuations were due to that. But in this situation, there may be some patients that are eligible to then go back on if the patient and their treating clinician and the study team all agree that that's appropriate for that patient. Figure 2 here outlines the dose modifications, which again are pretty usual for package insert with ribociclib. And I'm excited to see the data that comes out of this trial. Again, Adjuvant WIDER accruing now at a study center near you, Phase 3b non-randomized trial.